Welcome to Health Quest. I'm your host, Linda Frizzell, and today we're at the beautiful Riverbend Clinic in Mount Vernon. This clinic hosts a number of specialties, including pediatrics, dermatology. There's a pharmacy here and a lab. But today we're here in the orthopedic surgery area, and we're here to meet Dr. Sheu. Come along. Good afternoon, Dr. Sheu.
Hi, how are you?
Good. Do you have a few minutes to
Sure,
visit?
absolutely. Have a seat.
Great, thank you. Well, we really appreciate the opportunity to talk with you about the clinic here at Riverbend and also about orthopedic surgery in general and you, specifically what you enjoy most about that profession. So tell me where you grew up and went to school and all of that.
Yeah, I moved around a lot growing up. Did my undergraduate degree at University of Texas in electrical and biomedical engineering. Did my medical school training at George Washington University in DC. I went back to Texas and did my 5 years of orthopedic surgery residency at University of Texas. And then I did a one-year fellowship in Los Angeles in sports medicine and arthroscopy. And here I am today. So
impressive. So your undergrad degree was in engineering, two different kinds of engineering.
Correct.
At what point did you decide medicine sounded pretty good?
Ever since I was a kid, I always enjoyed working with my hands and excelled at math and sciences, and always enjoyed helping people. And I think medicine kind of incorporated all those things together. And so engineering was definitely fulfilling. I worked for a year in the industry, but I feel like medicine kind of made me more complete.
Wonderful, wonderful. Well, we're really glad that you're here at the clinic, and maybe you can next tell our audience a bit about this particular orthopedic surgery clinic. How many of you practice here?
Yeah, there's currently 5 orthopedic surgeons that work here. We cover the entire scope of orthopedic practice from head to toe. We also have 4 physician assistants who also help and assist in the care of our patients, so it's great.
Okay. So when a patient comes in and they present an issue to you, how do you figure out what's going on?
First and foremost, a thorough history and a complete physical examination is the first thing that you do.
Okay.
Sometimes diagnostic imaging such as x-rays, MRIs, and CT scans are needed to kind of help confirm the diagnosis and plan for surgery if needed.
So you're really doing orthopedic surgery on the athlete that might have a sudden injury.
Sure.
To the more mature adult who maybe just their body's getting tired and worn down.
Yeah, exactly right. In the older generation, most of the injuries are more degenerative, but the treatment really is the same with regards to the plan. We start off conservatively, and if needed, surgery is always last resort.
Okay. And then the rehabilitation part as well.
Exactly right.
Right. Okay. Do you have any great tips for the weekend warrior?
Weekend warriors, well, that's a tough one. It's always important to practice and to prepare as much as possible before any sort of activity, both mentally and physically. For weekend warriors, it's important to stay hydrated, make sure you have proper nutrition before and after the activity, and also to warm up and stretch before any activity. So those are the main things that can kind of help you avoid those injuries.
Mm-hmm. And applicable to everyone, because we should all be moving in some shape or form.
Absolutely
for good health,
right.
Don't you think?
Absolutely right, yeah.
So even though you can perform the whole gamut of orthopedic surgeries from head to toe, as you said, are there certain areas that you in particular like to do?
Sure.
Or specialize in?
Yeah. I'm a general orthopedic surgeon by trade, but I did do a one-year fellowship in sports medicine and arthroscopy. And so basically the shoulder, hip, and knee, I've been trained to perform arthroscopic procedures, which are small poke holes, minimally invasive, which allows for less pain and faster recovery. I also do fracture care and joint replacement.
Okay. So this is kind of an odd question, but when you do arthroscopic surgeries, you said it's kind of a pinhole, do you put air in there so that you can see, or how does that work as opposed to completely cutting somebody?
Yeah, so we actually inject fluid into the joint, and it basically cleans out the joint, and also at the same time it allows us to visualize all the structures inside of the body. So it's basically a fluid that goes in and out of the body.
Okay, fascinating. Let's talk more about sports medicine,
Sure.
because I know that's where your real passion is. You said you did a special fellowship in that. Tell me about that fellowship. I think the audience would like to know because you did some cool things.
Yeah, in Los Angeles, we worked and covered a lot of the teams there. Worked with a lot of NBA, NFL, NHL players. Spent a lot of time on the sidelines, in the locker rooms, and performing surgery. So it was a great experience, and worked with a lot of high-profile athletes.
So when you did that, is it a waiting game? I mean, you're just on call during the games, you're there in case something happens, or are you always working with them, rehabilitating them, that type of thing?
It's a little bit of both. We
Okay.
cover a lot of the games. We're on the sidelines or on the side of the field watching the games, and then additionally we get phone calls from the agents and a lot of the trainers about their patients' injuries, and they come into clinic when they can. So it's a little bit of both.
And you apply that here because you're working with local sports teams, correct?
Yeah, currently I'm the team physician at Skagit Valley College. I cover the basketball, soccer, volleyball, and baseball teams. And so we have clinic every week, and I cover a lot of the local games. I also cover the local high school football games, so you can find me on the sidelines every weekend.
Wow. So when you say you do a weekly clinic, you just show up at an appointed hour, and then any athlete who has an issue comes in to see you on that day each week?
Exactly right. So you never know what you're going to get, but I work pretty closely with the trainer there, and so anytime they need me, they can call me, but I usually try to go there once a week to kind of help out.
Do you mind if we drop by the college and see you in action on one of your clinic days?
Sure. Come on by anytime.
Here we are in the training room at Skagit
Linda.
Valley College.
Welcome.
How often do you come here?
So this is a weekly clinic that I do on Thursdays. I try to get here every week, but sometimes, we're busy at work, so we try
Right.
to come every week, but probably once or twice a month.
And then when you're here, are the athletes lined up to see you, or are these people you've already seen regularly?
It depends. Veronica's a trainer here. She's excellent. She tries to line them up to make it more easier for me to see them all at once, but sometimes it's a walk-in clinic, and so we're here for a couple hours each night.
So you do the whole analyze them, check them out, try to figure out what's going on, and then sometimes do you have to see them in the office later?
Yeah, usually we can take care of most things here at the training room, but if it's more serious, sometimes we send them over to the hospital, we get x-rays and imaging, and sometimes surgery if it's needed, so
Right.
it just depends.
Your time here is really pro bono, isn't it?
It is, yeah. I'm not paid to be here, but it's just nice to be part of the community and to see how the teams are doing and just to be a part of the community, so I'm just happy to be here and help out.
What a great gift that you're giving back to the community. I guess it shows your passion not only for great healthcare, but for sports.
Oh, absolutely. I try to stay active myself, and I feel for these athletes. Getting hurt is tough, and taking time out of what you love to do, and so getting you back as fast as possible. We're all in the same boat. So.
That's great. Well, thank you for your time, and it's just been so interesting to learn about what you do, and that we have the sports medicine specialist in you right here in our own community.
Thanks for coming by.
You bet. And thank you for joining us today. We'll look forward to seeing you next time on Health Quest.